Good evening, everyone. Good evening to all the wonderful women out here. It gives me great pleasure to welcome you all. I'm Samina Kausar, CEO for Ethika Worklife, the organization that is bringing to you a host of well-being events every single month. And today is no different. We have a very special event organized for you. 2020 has been a very powerful reminder that all of us are in this together, and our choices and actions have the power to protect us in a big, big way. The same holds true when it comes to breast cancer, or should I say, breast health. This is exactly why we have planned this very special event on breast health awareness to mark the International Breast Cancer Awareness Month. This event is about you, the women, you who actually, in most instances, don't really worry about your health, but you should be doing that. So it's about you, your health, and your happy life. So without any further ado, let me invite Dr. Pragnya Chirugupati, who is a consultant breast oncologist with the American Oncology Institute of Hyderabad. Dr. Pragnya, please take it over. Before Dr. Pragnya starts, I would like to tell you that we'll have the last 15 minutes of this session open for Q&A. So please use your chat box and ask as many questions you want to ask. We'll try to accommodate the most questions possible in the limited time that we all have. Thank you so much. Over to you, Dr. Pragnya.
Thank you. Thank you so much. Hi, everyone. Hope you can hear me well.
Yes. Yes, we can. Can we please have some yeses, and let's try to make this session as interactive as we can. We have an expert with us, and let's make a good use of this opportunity.
Hi, everyone. Thank you for the introduction. As we all know, October is the Breast Cancer Awareness Month. And I'm Dr. Pragnya Chigurupati Nara. I'm a consultant breast oncologist and an oncoplastic surgeon. I'm currently working at American Oncology Institute, Hyderabad. So in today's talk, what I actually want to explain to you is not only everything and anything about cancer, but I also want to introduce a bit of what benign breast diseases are and what the normal symptoms could be of any breast issue. So if you have any questions, please feel free to ask me at the end of the session. So before I go on to the breast cancer aspect of it, what you should know is that if you find a breast lump, it does not mean that it is cancerous. Obviously, you should know that all breast lumps are not cancerous. Around 9 to 10 of them are benign. All breast symptoms, however, and these symptoms include nipple discharge, breast pain, skin thickening, redness, axillary swellings, that's swelling in the armpit, change in the shape or size of the breast pain, etc. So all these are not always benign. And if you end up having a breast lump and they say it's benign, there's nothing to worry about, but it still stays for the next 30 or 40 years, be careful and just continue to examine your breast, because sometimes these benign lumps can turn cancerous as well. Cancerous or precancerous lesions do not always present as a lump. It can be any of the other symptoms that I just mentioned to you. You do not always have to lose your breast if diagnosed with breast cancer. Breast cancer is curable if it's detected early. And when you have any of these symptoms, what you should know is do not panic immediately, but at the same time, do not ignore, especially women above the age of 40. A quick note on the incidence of breast cancer in the world. This is the Globocon data in 2019. It clearly says that breast cancer is the most common type of cancer, which is up to 24.2%, followed by colorectal. This is amongst only the females. It's around 9.5. This is worldwide, remember that. And the mortality from breast cancer is around 15%, which is extremely high, followed by lung cancer, which is 13.8%. So you can see the clear distinction between the gap between the breast cancer and the colorectal cancer rates. Breast cancer is extremely high. In India, in 2018, amongst both men and women, the breast cancer rates are 14%. And this is where I'm going to highlight the fact that men can get breast cancer. It's not only the women, right? So, amongst all the cancers that were prevalent or newly diagnosed in 2018, 14% of them were just breast cancer. So, we know that predominantly it does occur in women, but it does occur in men as well, but at a very certain extent. It's just less than 1%. So imagine the kind of the percentage of cases that were diagnosed amongst the women just in this 14%. It is quite high, and so that comes up to around 27.77%, which common sense says that it's a huge number. And so, obviously, what we know is that breast cancer generally occurs in women about the ages of 40 or 50. That's postmenopausal women. That's what used to happen 25 years ago. So, if you see these graphs, the blue in this graph, the bar in the blue is 25 years ago, and the one in red is what the current status is. So, if you see this linear jump, it clearly shows that not only have the total number of cases increased, but it's more towards the younger age group where the numbers are increasing. So between the ages of 25 and 40, the numbers have drastically increased, which is absolutely a disturbing trend. To put things in perspective, what you should know is that the incidence in India and USA, in comparison, in the US it's 1 in 8, and in India, the rural areas it's 1 in 64, and urban is 1 in 22. And this is predominantly attributed to lifestyle factors. We also present in quite pretty late stages, which is stage 3, stage 4. 50% of them come to us in the later stages, hence the survival rates are pretty bad. When women come to the clinic, they used to ask me, what was the high, what happened? Should I get any vaccination against cervical cancer? Are there any vaccines for breast cancer? So cervical cancer before 2008 was the most common cancer in India. Whereas in 2008, breast cancer jumped and it took over in urban India, but not in rural India. But with urbanization and westernization, unfortunately in 2012, breast cancer took over both in urban and rural. So because vaccines came in, people are more aware of cervical cancer and the HPV vaccine. Now the numbers are 8 to 9%, and breast cancer rates are 25 to 32%. There is no vaccine, unfortunately. The only way of preventing is early detection. Survival rates across the world are improving, and especially in the US and UK, the survival rates for early breast cancer come up to around 90%, whereas in India, it's only 60%. And why does this happen? Because 40% of us are locally advanced at the time of presentation. That is, they come with massive lumps, they come with bleeding lumps, and sometimes it might have already spread to different parts of the body. So the risk factors for cancer, obviously, there are a few non-modifiable ones, and then there are modifiable ones. Age and gender, family history, length of reproductive life, and certain factors such as ethnicity obviously cannot be modified. But what we can change based on the awareness that we have are hormonal factors, which I will describe, and our lifestyle factors. So the age and gender are something which we cannot change. Obviously, the female sex is more prone to getting breast cancer. But age-wise, from the age of 40 onwards, 1 in 67 attain, breast cancer. Whereas if you're under 30 or between 30 and 40, it's 1 in 258. So from the age of 40 onwards, you have to be pretty vigilant. Not all breast cancers are only familial or hereditary. It's only 5 to 10% of them. So what I want to tell you through this slide is that what you have to do is go back home, ask about your family history. If anyone has a significant family history, that is ovarian cancer in the family, breast cancer in the family, or any other kind of cancer in the family, just try to understand if these relatives with cancers are related to you by blood. It can be either the paternal side or the maternal side, and try to analyze if exactly what happens even when you don't have children. The estrogen peaks are continuous, and there's no part of the entire cycle which falls down, or the estrogen levels do not dip down. Any late pregnancies, not having children, these are the causes of breast cancer to a certain extent. Which is why they say having a child younger than the age of 30 is protective, because that again dips your estrogen to a certain extent, because obviously women don't have their cycles through through pregnancy, and even during breastfeeding the estrogen levels fall down, hence that's protective. Most of us currently are on oral contraceptive pills, which to a certain extent do increase the chances of breast cancer. So, if anyone's using it, please try to use other methods of contraception, maybe barrier methods. Postmenopausal hormone replacement therapy, especially those with estrogen and progesterone, are used predominantly in the West, and we don't use it as much because Indian women are just prone to taking over their symptoms and dealing with them. But anyone using HRT, they have to be they should understand the fact that that puts them at a higher risk of breast cancer. And this slide is the most important because this is what we're all headed towards. With our lifestyle right now, with the fact that we're staying at home and working, it's more of a sedentary lifestyle. We are leading into obesity. We are more into junk food, Swiggy, Zomato, etc. We just order in. We don't have a healthy lifestyle. I blame myself as well. It's just not you, everyone. So when there's an increased body weight of more than 30 BMI, and when you take a high fatty diet, carbohydrate filled diet, low fiber diet, no exercise at all, sedentary lifestyle, just sitting, drinking a lot, high socioeconomic status, all of them just decrease the amount of antioxidants in the body. And obesity, especially in the postmenopausal period, helps in pumping in more estrogen into your system, and that's where we're doomed. Those directly attack your breast. Other factors such as race and ethnicity, the white population is more prone to breast cancer compared to us and Caucasians, etc. And the blacks, when it does occur in them, it's extremely aggressive. The next point here is benign breast conditions. What it means is that when this is all medical here, but what I want you to understand is that when you go get a mammogram done, for example, a doctor says, fine, there is something in the mammogram, I will have to remove it, so that you undergo the mammogram and they say, okay, fine, it's benign, it's not cancerous, you can leave. Please don't just leave with that statement in your head. What you have to again understand and ask the doctor is this a lesion which puts me under a higher risk of breast cancer in the near future? Because there are certain types of lesions such as atypical hyperplasia, sclerosing adenoma, etc., which are all medical related. So all that you have to do is ask them or reach out to a breast specialist. And previous chest radiation. Sometimes younger girls have cancers when they're younger, unfortunately. So for example, in the neck and in the chest. So when they get radiation to that particular anatomical part of your body, the chest automatically gets prone to those radiation rays, and that makes them prone to breast cancer at a later stage. So now that you know the risk factors, what are the screening techniques? There are three: breast self-examination, clinical examination, and mammography. I will talk about what's pertaining to the Indian scenario. Mammography has shown to be more effective in the postmenopausal patients, and menopause generally occurs at an age of 50, right? But in India, the average age of diagnosis is between 40 and 49, diagnosis of a cancer. So, although mammogram cannot be adopted as a standard screening in our country because of our population and the lesser number of resources that we have, every woman should start getting a clinical breast examination, which is what the doctors do for you when you reach out to them in a clinic, and a mammogram from the age of 40. Remember, from the age of 40, they should be extremely vigilant. Before this, from the age of 25 onwards, you have to examine your breasts and understand if what your normal breasts feel like. Because if you don't know what your normal breasts feel like, you won't know how the abnormality changes it. Breast self-examination. This is the most important aspect of the stock. Obviously, it's easy, simple, cheap. It can be done by you at home. When should it be done? In a premenopausal woman, at the end of your menstrual cycle, 2 days after that, every month. And in a postmenopausal woman, choose any day of the month and repeat the same examination the next month as well. And there are two steps to this. One is you look. So, in any chosen day of the month, you just go stand in your bathroom, undress yourself, stand in front of a mirror, and just look at your breasts. Put your arms by the side and notice any skin changes, notice any lumps or fullness, any swellings, nipple being pulled in, any change in the size or shape of the breast. Then you can put your arms on your hip and tighten it, just push it into your hips. Sometimes, if there are any lumps or any skin changes, they get more obvious. You can also raise your arms above the head to see, look for any visible skin changes, which might, if there is a lump present in the breast, it stays stationary in the breast, whereas the skin over it keeps moving. So it becomes more obvious when you raise your arms above the head. But also remember that you have to look at the undersurface of the breast and the outer surface of the breast. The next step is to feel. Go to a bed, just lie down, place a pillow behind your head, place your arm below your neck, and just examine yourself in one of the two ways. This can be done either in the shower or on the bed. You can either go in circular motion, as in this picture, wedge like in this way, or up and down and side to side. I personally prefer the circular manner, but you can do anything you want to. Self examination obviously is not complete unless and until you examine your armpit as well. And you have to examine the breast from your collarbone to the middle of the chest, underneath the breast, and the outer aspect of the breast. What do you have to look out for? I hope you don't get scared looking at these pictures, but it's just something that I really need to show you to make you understand what you're looking out for. Swelling of fullness of the breast. This is how it looks like. This is how a lump would look like when you're just looking at yourself in the mirror. Lumps or swellings in the armpit, especially when you raise your arms. Nipple inversion. This is a picture of a nipple inversion. Any discharge or crusting. And the discharge can be green, yellow, whitish, milky, or blood-like, which is in this picture. Skin thickening or skin redness, change in the size or shape of the breast. So these are the common issues, symptoms, and signs that you look out for. But there are a couple of specific signs which just keep in your mind. Something called purerange. So your breast becomes something like an orange peel, which is a sign of late stage cancer or infection. Again, inflammatory breast cancer, the entire breast becomes red, warm, heavy, and thickened. And if you go to a regular doctor, sometimes what happens is they might get confused because an infection looks like this as well. So they might put you on antibiotics. But remember that if antibiotics are not decreasing these symptoms, reach out to an oncologist or a breast specialist. Page's disease of the nipple. Sometimes, especially in lactating mothers, you have nipple crusting, nipple cracking, whitish color changes in the nipple, sometimes itching, redness. When those signs do not subside on medication or moisturizers or steroids, you have to suspect a condition known as Page's disease of the nipple. So if your nipple looks like this, please again reach out to a doctor. Also be aware that sometimes mammograms might detect a very, very early breast cancer. So mammograms obviously are important from the age of 40. And metastatic symptoms, that is, that if a cancer already is present in your body and it's spread to different parts, such as the bone, your lung, your liver, or your back, you have different symptoms such as bone pain, neurological deficit, breathlessness, cough, any pain in the abdomen, jaundice, etc., based on where it has spread. And they might be the initial presenting symptoms. So be watchful for them as well. When you have a breast lump, when you go to a doctor, make sure that first of all you are clinically examined. Second is mammography. Do not undergo any surgery for a lump unless and until you get an imaging. It could be the form of a mammogram, MRI, or an ultrasound. Please note that an ultrasound is generally done only in a woman younger than the age of 40, but a mammogram from the age of 40, and an ultrasound can be done along with a mammogram, but do not go ahead for surgery without an imaging. And then an FNAC and a biopsy. FNAC is basically a needle which is placed into the lump, and a few cells are taken for pathological analysis. And a biopsy, I'll explain it to you in the next slide. A clinical breast examination is how we examine you in the outpatient clinic. Mammogram is when your breast is placed between two plates and it is pressed from top to bottom and side to side. So we get two views, something like this, and we look. If you can note the little lump here. So we find these lumps, and then we take you ahead for a biopsy. A biopsy is done with a gun like this, and this is a fine needle aspiration cytology, which is with a little needle. A quick note before I am coming towards the end of the presentation, but a quick note on what you should understand. If anyone in your family ends up having breast cancer, God forbid, there are systemic therapies and local regional therapies. Local regional are just the breast, but since breast cancer as such is a systemic disease, there are aspects such as chemotherapy, hormone therapy, and targeted therapy based on what the breast lump presents as. And unless you have a physiotherapist, nutritionist, and counselors on the team of doctors treating the patient, your treatment is not complete. Back in the day, in the 1800s, the first surgery was done for breast cancer when the entire breast was removed in Egypt, and the entire breast was removed with the underlying muscles, and it was a massacre. But with advances, thankfully, today we can conserve the breast and even reconstruct the breast in multiple different ways, making sure that the woman has good quality of life. This is something called breast conservation surgery. There was a lump here, we removed it, we just and we did the axillary surgery. So ultimately, you can preserve your breast, obviously, if it's oncologically safe, and you will get radiation after a breast conservation surgery. So how do you prevent this? Breast cancer, there are certain modifiable aspects and there's certain unmodifiable aspects. Exercise and weight loss is very, very important, especially in a postmenopausal woman. Awareness and routine self-examination every month. Clinical examination from the age of 40, along with a mammogram. And can breast cancer be preventable? The non-modifiable risk factors obviously are unavoidable, but the modifiable risk factors, such as having children at a younger age, breastfeeding the children, avoid taking too many oral contraceptive pills for long periods of time, hormone replacement therapy, exercise, diet, all of them are in our hands. Certain myths and misconceptions. Finding a lump in your breast means you have breast cancer? Absolutely not. 9 out of 10 lumps, like I mentioned in the beginning of this presentation, are benign. So do not panic, but do not ignore it as well. The other myth is men do not get breast cancer. Again, absolutely not true. 1% of men do get breast cancer. So they should examine themselves on a monthly basis as well and note their changes and come up to a doctor if there are any. Because breast cancer, if it comes up in a man, it's extremely aggressive and tends to be detected late. And hence they have a very bad prognosis. Hence, it's mandatory that they examine their breasts as well. Another myth is having a family history of breast cancer means you will get breast cancer. Not entirely true. You have to understand the family history in your mother, daughter, sister, grandmother, father, and anyone on your paternal side. And if you are at a high risk, you have to keep start getting a mammogram 5 years before the age of the diagnosis. And today, in fact, in clinic, I was asked, unfortunately, a patient was diagnosed with breast cancer. I have to go back home and can my grandchildren use the same glass I use because I have breast cancer? She thinks breast cancer is a contagious disease. That is so not true. Breast cancer is nothing but uncontrolled cell growth in your own body, which causes that disease. So obviously it's not communicable. Surgery for breast cancer means removal of the whole breast. Again, that's not true. With the recent advances, conserving your own, the whole breast and reconstruction, the cosmetic results are excellent. So are the oncological results. Possible strategies for primary prevention or risk reduction. Breastfeed, early pregnancy, avoid the use of estrogens, avoid postmenopausal weight gain. Make sure you have 5 servings of fruit, vegetables, whole grains, anything rich in antioxidants and phytochemicals a day. more than 3 hours of physical exercise every week. That could be just brisk walking to more aggressive than that. Replace saturated fat with olive oil and other oils high in MUFA. Limit alcohol and quit smoking. These, you'll be surprised how much these would actually help you in overall health and prevention of cancer. But obviously, for a career-oriented woman like you or me, although I would never discourage them from making their own career, just be smart about your biological timeline and go ahead and plan it. So yeah, thank you. If you have any questions, feel free to reach out to us. These are my contact details. You can WhatsApp me, and I will try to respond to you as soon as I can. Or you can just reach out to American Oncology Institute if you want to see me for any queries or if you want to get examined. Thank you.
Thank you so much, Dr. Pragnya. That was very, very insightful, I must say. Right from understanding risk to early detection to the examination and what could be probable treatments, I think we got a hook of almost everything. I was just thinking when you were talking to understand how do we even avoid this. So I think in the last slide you covered that as well. So thank you. It's always said, and I know you'll vouch for that, that prevention is always better. So that's the thing to go about. So I
Yep.
now invite all of you to please post in your questions. We have Dr. Pragnya, the expert, with us to help us with all the queries. If there's anything unanswered or anything that is not covered, this is just the right opportunity. Please use your chat bots and we will try to address as many as possible. We have a good 20 minutes, so we can utilize that in case you have questions. As people start thinking about what they should be asking, Dr. Pragnya, I'll go first and ask you.
Yeah.
Age is a very important factor, is it?
Yeah.
Yes, it is. And above 40 is when we have to be very, very particular and vigilant.
Yeah.
Is that correct?
Yes.
Okay.
Yes.
All right. Is there, you have already talked about the major lifestyle changes that we should look at doing. Um, the fact around breast cancer or belt hairs is more of a scare that we have. Everybody has a scare, and it's the fact that we feel it's not in for me. I mean, everybody understands that it's not for me. So people try to avoid even the examination part, isn't it? But how critical it is, especially all of us who are working women, we have very rampant ad hoc lifestyles. So how practical it is to ensure that we evade this and stay healthy, avoid the risks that are there.
So, unfortunately, self examination does not prevent breast cancer, it helps us detect it in an earlier stage. Prevention, and the only ways you can prevent it is that, again, lifestyle modifications and having a healthy diet, etc., and having children at a younger age, breastfeeding them. These are all theoretical aspects. Some women, unfortunately, despite doing all this, do end up getting breast cancer. But maybe some people do not because of this. We don't know. What we do know is that these causes do cause breast cancer in the future.
Yeah.
Having said that, if you examine yourself on a monthly basis, we will be able to detect that breast cancer in an earlier stage. And then even if it's been confirmed, we give you a better survival rate at the end of it. Because women, especially in the younger age groups, are aggressive cancers, right? Especially under the age of 40. So if you find anything abnormal, it's better to come to us to an earlier stage. Because if it gets a little aggressive means that the breast lump can increase in size within a span of months, right?
Okay.
So if you even delayed by a couple of months for whatever reason, if you have a wedding in the family or COVID, etc., I understand that COVID is a huge scare for everyone, but you'd rather protect yourself now than worry about it later when it's spread to different parts of the body, which is why we keep saying early detection is absolutely imperative.
Wonderful. So we also have questions coming in now, Dr. Padna. I'll take the first one. The first question says, if there is no family history of breast cancer, what are the probabilities or the chances of getting one?
So there are no numbers for this, right? All that we can say is that right now there are 1 in 22. We all come under urban India, urban Indian women. So now 1 in 22 women get breast cancer. We cannot pinpoint on any particular woman saying you might get breast cancer because you're doing this. We can't do that. But family history is something that pushes us to understand that we can get breast cancer in the future. So we will automatically get under better surveillance and earlier surveillance. But amongst average risk women, the only thing that you can do is be vigilant and examine yourself. So God forbid you get it, we just catch it at an early age. But there's nothing that we can do. There's no probability of you getting breast cancer over the other person.
Okay. I'll take the next question, which is from Shivani. She says, is wearing bra while sleeping safe for breast?
Yeah. Wearing a wearing a bra or the undersurface of a bra, tight straps, etc., do not cause breast cancer. What it does is that sometimes because of the hygienic conditions in the undersurface of the breast, you're prone to more infections. But bras causing, you can absolutely wear a bra when you're sleeping if that's what you're comfortable with. But we generally suggest take off your bra because there's not going to be too much movement. You don't need too much support at night. Or you can wear a soft sports bra sort of thing. It completely depends on your comfort level.
Okay, but it does not increase the risk of
That's another.
breast cancer at all. So that's a pure myth. Yeah, that's a myth again. All
One
right.
second, I have a private question. I won't name the person, but I stopped lactation when my baby was 4 months old. Any chances of increase of the lump? So no, you have lactated, you have breastfed, so that's good. It does not. We don't know the exact number of months you're supposed to lactate to prevent breast cancer. What you did by breastfeeding is that you've cut your estrogen peaks by a couple of months, and it does not. So what happens during breastfeeding is that women do not get their periods back even while they're breastfeeding to like 4 or 6 months, and some people get it back in the first month. For every woman it's different. So while the person does not have periods, the estrogen peaks that happen every month during your periods just come down. So total exposure of estrogen as such decreases in a lifetime. Hence you're protecting yourself against it. But there's no specific number saying 4 months. I've breastfed my child for 4 months. I've breastfed my child for 8 months. Am I going to get protected? No. Lactation helps in the growth of the baby as well as it gives them a lot of nourishment. So lactate as much as you can, but don't go on for 5-6 years. Around 1 year is good enough.
Yeah. So I'll take all the questions in private mode only. So please feel free to ask what you want to ask. The next question is, does the probability of getting breast cancer increase with the size of breast?
No. Size of the breast does not cause breast cancer, but there's if a person has a large breast cancer, chances of missing the breast cancer on examination, your clinical examination, or examining yourself, that's breast examination, may be slightly higher compared to a smaller breast, but the chances of breast cancer does not necessarily increase. It depends if more likely that the person might be in a higher BMI if they have massive breasts, right? So it's that fat that converts and attacks the breast. But having said that, there are a few women, very, very thin women with big breasts as well. They should be vigilant. It does not necessarily mean that the size of the breast cancer rates increase because of that. I have another question, which is private. How is late pregnancy a probable cause for breast cancer? Unable to understand the reason behind it. So again, you're increasing the risk of all. So the hormones, there's a hormone imbalance that occurs, especially about the age of 35. You're from the age of menarche, which is around 12. That's when you attain periods. You're giving a huge estrogen peak up till the age of 35, 36. You're not giving it a gap anymore. So you're giving that estrogen all the right it does to go and attack the breast throughout. So that's how it increases it. And after 40 or 45, relatively the hormone levels slightly decrease. So it leads to a slightly lower chance of breast cancer. So that is that answer. Any more private?
For everybody's help, can you please put in your number also in the chat box,
Yes.
Dr. Pragnya, so that because a lot of them are asking for your number, so that will help. Please note down all of you. And as I said, we'll take all these questions in private without taking your name. So please feel free to put in whatever questions you have here.
That's my number. You can WhatsApp
Okay,
me.
that's the doctor's number. So next question is, if the breast has been removed and getting detected after getting detected of breast cancer, the possibility of getting breast cancer again, is it reduced or is that still a possibility?
So, are you talking about breast cancer in the same breast or the opposite breast?
Yeah. You can
Okay.
unmute yourself and ask as
Yeah,
well.
you can ask me that question because there are two different answers to that.
We'll put both the perspective, the same and generally.
Okay, so, sorry, I'm just looking at my contact detail for her and I will get back to the question. I forgot my email address.
Yes.
Um, okay, let me just put it up at the end. I don't.
Yeah.
Yeah,
So,
yeah. So that is my email address as well. You guys can email me on that. So getting back to your question, I have, for example, I've been diagnosed with breast cancer, right? Today you can remove your, obviously a mastectomy is a surgical option that people take. The second option is breast conservation surgery, which is associated with something called oncoplasty, which is reconstruction or not. It completely depends on your breast type, the biology of the tumor. Now, is it oncologically safe or not? Will it return to me? If you get radiation to the breast, it after a conservation surgery, it's oncologically safe and equal to a mastectomy as of today, which is why we propagate a breast conservation surgery in women. Will it return? It completely depends on the biology of the tumor, the how much it's spread, the stage of presentation, the receptor status at presentation. Even in women who have a complete mastectomy done, entire breast is removed, chances are that it can erupt on the chest wall also, because it's the biology that dictates the entire cancer. Yes, obviously removing the breast or doing a conservation surgery with radiation, we're trying to reduce the chances as much as possible by also giving systemic treatments. But at the end of the day, it depends completely on the stage of presentation, the amount of systemic therapy you get, and how well you're followed up.
Yeah. So it's completely case to case basis,
Yes.
right?
The second part of this question is if it can come in the opposite breast. Yes. If a person is diagnosed with cancer in the younger age group, and even if a breast is removed or completely treated, they can get it in the opposite breast in around 20 or 30 years or more, or immediately as well. Again, that depends on the biology of the tumor and how well the surgeon operates, or make sure everything is analyzed well. It's you just when you go to a doctor, the doctor has to understand breast diseases as a whole to understand what can recur and what can't recur. You have to be counseled extremely well. You have to understand what the risk factors are. You should be explained all that, and based on that, a decision has to be made. And to add to that, those with a family history of breast cancer, there are chances of getting it in both the breasts at a younger age as well. I hope that answers the question.
Yeah. The next question, I think you've already addressed that, but I'll still read out the question. How can we do self-examination or evaluation to detect lumps before we approach for medical help? I think we had good two
I
slides on
explained
it, but if
that.
you want to recapitulate.
So if anyone wants to understand the self-examination in detail, my website is coming up. This is absolutely no publicity. I'm just making sure. But my website is coming up. I'm trying to put up a video on it, which shows every step of examination. And you can probably just watch that for a second or so, and then you can understand yourself. Or any video on YouTube will help you.
Yeah, wonderful. Okay, any more questions?
Yeah, there's a couple of
Please, we have,
questions here.
yeah, yeah.
I sometimes feel heaviness in one of my breasts. I have even met a doctor about it, but that time, as I was breastfeeding, doctor asked me not to worry, also suggested some things were okay, but I sometimes feel heaviness. Breasts change after you lactate. Breasts change after you get pregnant. What you should understand is, again, start examining yourself and feel how your normal breast feels like. Breast heaviness, especially before your menstrual cycle, is absolutely normal. And if you're still very doubtful, please reach out to a breast specialist. The other question is, does not wearing a bra for longer time affect your breast in any case? They get saggy. It's not protected well, right? So they get saggy, they droop down. So it's more of a cosmetic effect than any biological effect there. Yeah, that's it. I don't have any other private questions.
Right. Okay, doctor. One question that I have, in one of our network, there was one lady who had problems uh, with cyst formation. She had this cyst, and she couldn't even bend or do any work. It was very, very painful for her. So she was suspecting that it could be, breast cancer. So is there any demarcating or differentiation factor that we can know that this cannot be breast cancer or this can be? Just to bring down that element of scare and fear, I'm asking you this question.
So, how does she know it was a cyst?
I'm sorry?
How does she know it was a cyst? How does she know that the lump
That
that
it
she,
was a cyst. In
yeah,
one of her earlier examination, a gynec has examined and told her that it is just a sebaceous cyst. But that subsided, it was fine. And again, after a few months, she got intense pain than what she was experiencing initially.
in the
So
same?
she was suspecting the same place. And the same place, the cyst, she got the cyst again. This time it was harder. This time, I believe, it was very painful for her. She couldn't do any work. She couldn't bend also. So she was just wondering if she needs to go back to the gynec or should she go back to the oncologist? Or should she, sorry, not go back, but go to an oncologist?
So that's where things come in, right? All breast diseases are not oncological based, and that's where a breast specialist comes into the picture. Unfortunately, people don't understand that going to an oncology really messes with their mental status as well, especially because they don't have a cancer. For all you know, it's just a simple cyst on your breast. In this case, in the case of this woman, if it's truly a sebaceous cyst and it's recurring multiple times, causing her difficulty in day-to-day activities, I would suggest a small removal if it's a sebaceous cyst. This is completely based on what you told me. But if there is anything in the breast, it obviously has to be evaluated by the doctors and
Hmm.
herself as well. She has to examine herself and reach out to someone,
Hmm.
any doctor.
Okay. All right.
And
There's another private.
imaging has to be done.
Imaging is a must, doctor, for a clarity is what you're saying. All right, that makes a lot of sense. Okay, there's another question. Okay, are these questions limited to breast cancer? Yeah, we are having this session on breast health awareness and breast cancer awareness. So anything related to that, please ask. We have very limited time now left. Probably we can take another couple of questions more. We also have the doctor's number and email ID out here for you all. In case you want to talk to her in private and get to know more, you please use that contact and go about it. If there's any other question that we can address on this platform, please feel free to use the chat box. All right. I'm assuming that we are done with most of our questions. Okay, there's one more. So is the heaviness in breast normal? That's another question.
Yes, it depends on what part of your during the part of your menstrual cycle there is heaviness. Heaviness is normal if it's around your menstrual cycle and it decreases after your period start. But if it's throughout, then you have to be examined.
Okay. I hope that answers the question. Any further questions as we are closing very soon? Please put in any more unanswered questions that you may have.
Hi, my name is Shraddha. Very good afternoon, Pragna and Samina.
Hi, Shraddha.
Thank you so much for asking my previous question. Answering my previous question. I'm sorry, I had this very general confusion and doubt for a very long time, and I'm only taking this question up because we have 10 minutes left and there are no further questions. So it is not in particular to breast cancer. I'm sorry about that, Pragna. But you being an expert in this field, I would just like to ask from a women's health perspective. I've read on a lot of articles that for people who start their married life late in the late 30s should probably start exercising, and these exercises should majorly be about Kegel exercises. But I've never gotten an opportunity to understand what exactly is a Kegel exercise. Can you throw some light on it, please?
Kegel's exercises, from my knowledge, are something that strengthen your pelvic floor. and they generally say as the woman ages, you have to do a lot of these Kegels exercises, because if you're going to give birth to a child, right, as we age, all our muscles generally tend to get really weak slowly, like over a span of time. So unless you strengthen those muscles, there are chances that you might, for normal delivery of the baby, you might not be able, the canals have to be absolutely strong, because I can't explain, but this is the pelvic floor, and then these are the canals that through which the baby comes out. So unless these floors are absolutely strong, it's tougher for the easy passage of the baby. So that's why they probably suggest Kegels exercises for women in the older age. It's also suggested to any woman or man who have lower urological issues, or cervical issues, or vaginal issues, rectal issues. They just basically help strengthen the pelvic floor, if that makes sense to you.
Yes, it does. Thank you.
I think that answers your question, Shraddha.
It does, Samina. Thank you.
Okay, thank you. I'll move on to the next question, Dr. Pragya.
Yeah.
It's any suggestions to expecting mothers to keep the breast in good conditions? Any special suggestions you have for expecting mothers?
So okay, this is a question that I have to think about. Can you repeat that question, please?
Yeah. Any suggestions to expecting mothers to keep the breast in good health?
Good health.
Yeah. Maybe because there is a lot of hormonal changes and all, she's asking that in particular.
So there are, I don't mean to scare any expectant mothers, but yes, when there's something called pregnancy-associated breast cancer, which does happen in women. So I would still say continue to examine yourself during pregnancy as well. And if there are any changes, first reach out to someone. Obviously, the way we examine you, the imaging we use for pregnant women it's slightly different compared to what you would use on me or any average risk person. But one other thing is, in the immediate postpartum, that's once they give birth to the baby, that's another time which you have, in breastfeeding time, you have to be very careful about the changes that happen in your breast, because it's very easy for infections, it's very easy for confusing lumps to occur in the breast. And going to a right doctor again is important, because infections can occur, but they might have a small speck of cancer in them. That's very rare. Do not get scared, which is why I didn't even mention this to anyone. But it does happen. And maintaining good health, again, you have to take your multivitamins. And for the breast as such, there's something called primrose evening oil and vitamin E capsules that generally help breast health. But besides that, I really can't think of anything else for pregnant women. Just continue examining yourself and understand any change that occurs in the breast.
Yeah. So then examination is the key, doctor, in whichever stage you are in, right?
Which is the one takeaway message from today.
Yes, from today's session. Absolutely. Okay. Thank you. Thank you for that. Yeah. Any further questions before we close for today? Yeah. Okay. Thank you so much, Dr. Pragya. This was very, very insightful. Again, I want to reiterate, there was so much of unanswered questions that you have addressed. There were so many myths that you have broken. And hopefully we get inspired from this session and do our bit to change our lifestyles and to avoid the risk to breast cancer and ensure that we are in the pink of breast health. Thank you so much.
Thank you.
Thank you so much, everyone, for being a part of this. Thank you so much.
Bye.
Thanks for this session.